The new NHS Alliance Action Summit has a proud history of disruptive ideas that can be the catalyst for change within the health service. We sent Sue Saville to speak to the innovators and pioneers that are spearheading a new movement in healthcare.
Today, the theme of our event is around the value, both social and economic, of health creation.
The new NHS Alliance came together to champion the power of people and communities, ideas that are now being taken up by the NHS establishment.
The NHS is only part of the answer. Is only a very small proportion of health creation.
How to enable and deliver health creation were explored, with examples from the lived experience of seldom heard communities.
Traditionally, the traveller people haven't spoken out, and because we haven't spoken out, we haven't had any services, we haven't had any treatment. In fact, what we've had is mistreatment.
I think it's really important that we get a voice, that we're able to actually share what's really happening and also to be part of the solutions.
Investing in health is investing in wealth. That's the message at this conference, calling for a new paradigm to address health inequalities.
To invest in health and to invest in communities and to invest in people's lives is also good for the economy. Because if you're ill, you won't be working very well. If you don't feel good about yourself, you won't be good about going into work in the morning. So to invest in people and communities is an economic investment, not a cost.
To gain economic benefits from health creation, starting at community level was seen as the key.
What we did in Holland was just learn from a small experiment and then scale it up nationally. And I think that would be possible in the UK too.
All of the stresses that are caused by poverty and welfare reforms, they're not medical issues per se, yet we're giving them a medical response, whereas actually the kind of help people need is much more social and structural.
It's really amazing for us to have a platform here today with commissioners and health practitioners and share some of the work that we find to be really effective with marginalised communities.
Listening more to community voices was an important lesson learned in the aftermath of the Grenfell Tower fire.
To be hearing what people say about how they want to feel valued, how the skills and capabilities that they have as a community can be part of the solution, how we understand that, how we respond to it, how we make that part of the bigger humanitarian effort.
Ideas from the third sector, from charities, are now taking root in public organisations.
A job, a home and a friend is more crucial than anything else we might do.
The work done on the ground was honoured in the NNHSA Awards.
Our winner is Sheffield Flourish Community.
And for all here today, it proved worthwhile.
Even if we don't win it, we've still been shortlisted, and I'm coming to represent the Speak Up group for Margate and also to promote our cause, which is for mental health.
What inspired me to come today was this whole notion of health and creation and coming from a bottom-up approach of people and communities.
What's happening now is actually solutions to all the questions that we've struggled with in the NHS for so many years.
Knowing that answers lie in communities, the next step is to put the creation of wellness on the academic curriculum.
There are professionals and communities everywhere that have the capability and the potential to create the conditions for people to be well. And we know how to do that. But it's not in the curriculum, and we want to make that happen.
The social movement started by the new NHS Alliance is flowing into the mainstream. It's about people, not pills, to solve society's ills.